Welcome to this video. So in today's video I'm going to explain about the median nerve. So this video is in continuation of a previous video. In a previous video we saw a pregnant woman who had carpal tunnel syndrome, which was due to median nerve compression. So in this video we are going to learn in detail about the anatomy of the median nerve, its course, its action, its muscle supply, and also the various signs and symptoms caused due to median nerve injury. Let's now trace the median nerve from the brachial plexus. As you all know, it gets components from both the lateral cord and the medial cord, which descends downwards and medially and reaches the cubital fossa. In the cubital fossa, it lies medial to the brachial artery. As you all remember the mnemonic MBPS, which refers to median nerve, brachial artery, tendon of biceps brachii, superficial branch of the radial nerve. This refers to the content of the cubital fossa, and which continues further downwards and lies between the muscles pronator teres, below the muscle pronator teres, and it gives off many branches to the anterior compartment or the flexor compartment of the forearm. So flexor pronator muscle group. It also gives muscle supply to the thenar muscles, which is the abductor pollicis brevis, opponens pollicis, flexor pollicis brevis. Okay, and also first and second lumbricals, which is the lateral two lumbricals. The medial two lumbricals is supplied by the ulnar nerve. This point is very important to note. Okay, the sensory supply of the median nerve can be traced from this diagram. As you can see, the median nerve supplies the thumb, index finger, middle finger, and the radial half of the ring finger. So this is the sensory distribution of the median nerve with concern to the palmar side. In dorsal side, it supplies the dorsal nail bed. Okay. So this is the sensory distribution of the median nerve. In our previous case, in a pregnant woman, she had symptoms of tingling and paresthesia along the course of this sensory distribution of the median nerve. So it is an anatomical correlation which you have to remember. And also, let's now discuss further the signs and symptoms caused due to median nerve injury. So in case of abductor pollicis brevis, if it is injured, there is an interesting test which was asked in NEET PG. It was asked in NEET 2021. This test is called as the pen test. Nothing but a patient is asked to keep his hand like this, and a pen is placed on top of his hand, and is asked to touch the pen with the help of his thumb like this. So this action is done by the muscle abductor pollicis brevis. In case of injury to the median nerve, this test cannot be performed. So it is an interesting test to test for abductor pollicis brevis. And opponens pollicis. So the only thing which is different between us and the apes is this. Not the only thing. Obviously there are many other things to differ. I am saying in anatomically. So the apes cannot distinguish their thumb and do this action. So this action is called as the opponens. This is done by the muscle opponens pollicis. In case this muscle is supplied by the median nerve. So in case of injury to the median nerve, there is loss of opposition. So the hand tends to remain in this position, as you can see from this diagram. So this is ape's thumb. So as you can see in this patient, there is median nerve injury. So he has the thumb which cannot do the action of opponens pollicis. So that it is referred to as the ape hand. Also, there is wasting of the thenar muscles, which is also seen prominent in case of median nerve injury. And the other thing which is important in median nerve injury is the benediction hand. What is this benediction hand? In case of when a patient with median nerve injury is asked to make a fist, normally when we are asked to make a fist, we do make a fist like this. But in case of a median nerve injury, the patient can actively flex his little finger and ring finger, but he cannot flex his thumb, index and the middle finger. This is because the flexor muscles, which is the lateral two lumbricals, which is supplied by the medial nerve, is affected, so that the patient cannot do flexion of the fingers, and also due to the unopposed action of extensors, which is supplied by the radial nerve. So these two components, unable to do the flexion by the lateral two lumbricals and unopposed action of the extensors supplied by the radial nerve. This in turn causes the benediction hand, which is similar to what the popes do to bless people. Okay, so this can also be tested by another test, which is called as the Osner clasp test, in which the patient is asked to clap, but he cannot flex his index finger. This sign is called as pointing index. It is also a sign of median nerve injury. And further, you can also see the anterior interosseous nerve. It is a most important branch of the median nerve. So in case of injury to the anterior interosseous nerve, the patient cannot do the OK sign. This is the normal OK, a super kind of thing. It is an OK sign, but these patients cannot do this, and they will do something nearest to this. They cannot do this perfect OK sign. They will do this one, which is called as the weak OK sign. Okay, this is a weak OK sign. So in this video we have discussed about the anatomy of the median nerve, its course, the muscles it supply, and also the various signs and symptoms which are caused due to median nerve injury. Thanks for watching and supporting.